Hi guys, my name is Mariam and I'm really happy to share my information about medical mycology and laboratory courses with you all. Subscribe please for more. In this video, I'm going to talk about dermatophytosis. What is dermatophytosis? Dermatophytosis is a common skin disease caused by dermatophytes, also known as ringworm fungi. These infections affect the skin, hair, and nails and are often difficult to diagnose. They respond rapidly and can be managed satisfactorily if treated correctly. The clinical presentation depends on the site of infection, host's immunological response, and the infecting fungus species. Infections are named based on the anatomical site involved, with tinea capitis being the most common in temperate countries and tinea capitis and tinea corporis is in tropical countries. The causal organism and their habitat. Dermatophytes, including trichophyton, microsporum, and epidermophyton, are keratinophilic fungi found in the dead keratinized tissue of the skin, scalp hair, and nails. They are classified as geophilic, zoophilic, or anthropophilic depending on their habitat. Geophilic dermatophytes can cause infection in both animals and humans, but their normal habitat is soil. Anthropophilic dermatophytes are highly specialized and rarely infect other animals. They are found in the stratum corneum of the skin, within and around scalp hair, and in the nails. The type and extent of hair invasion varies according to the species of dermatophyte, with some species forming a sheet of arthroconidae around the outside of the shaft or ectotrix. The type and extent of hair invasion are not specific, but culture is required to identify the species of fungus causing the infection. Epidemiology. Dermatophytosis is a contagious host-to-host transmissible disease of human and animals acquired through direct or indirect contact with infected individuals. Infection with zoophilic species like microsporum and trichophyton occurs through direct animal-to-human contact, while geophilic species like microsporum gypsium involve transmitting soil-borne inoculums. It is a common dermatological condition in industrialized countries with an estimated 10 to 20% lifetime risk. The US population has an estimated 4 million physician visits annually between 1995 and 2004. The prevalence of specific dermatophyte species varies across geographical locations, with Trichophyton rubrum and Trichophyton interdigital being predominant in northern Europe, Microsporum canis in central and southern Europe, and Trichophyton rubrum and Trichophyton tonsurans in North America. Trichophyton violacum is common in eastern and southern Europe, North Africa, and parts of India. Laboratory diagnosis of dermatophytosis. Superficial fungal infections such as dermatophytosis require laboratory investigations for correct diagnosis and management. Laboratory confirmation is crucial before committing a patient to long-term treatment, which may incur significant costs and potential side effects. Isolation and identification of the etiological agent can help control infections due to domesticated animals with an ongoing source of inoculum. Diagnosis can be made through direct microscopic examination or isolation of the etiological agent in culture. It is essential to provide sufficient details about the patient, including age, gender, body size, underlying illness, drug treatment, contact with animals, recent travel, and previous residence abroad. Direct microscopic examination is often sufficient for diagnosis, but it does not provide information on the species involved. Culture is a more reliable method as it allows the species of dermatophyte to be determined, providing information on the infection source and aiding the treatment selection. Several nucleic acid amplification methods have been described for direct detection of dermatophyte DNA in skin and nail specimens, but none have become established as routine diagnostic procedure. Conclusion: Dermatophytosis is a common skin disease caused by dermatophytes, also known as ringworm fungi. These infections affect the skin, hair, and nails and are difficult to diagnose. The clinical presentation depends on the site of infection, host's immunological response, and the infecting fungus species. Dermatophytes are keratinophilic fungi found in dead keratinized skin, scalp, hair, and nails. They are classified as geophilic, zoophilic, or anthropophilic depending on their habitat. Dermatophytosis is a contagious host-to-host transmissible disease of humans and animals acquired through direct or indirect contact with infected individuals. It is a common dermatological condition in industrialized countries with an estimated 10 to 20% lifetime risk. Diagnosis requires laboratory investigations, which can be done through direct microscopic examination or culture isolation. Culture is more reliable as it allows for the determination of the dermatophyte species, aiding in treatment selection.
Love you guys. Subscribe please for more.